Welcome to this educational video on Levator-Ani syndrome. This often misunderstood condition can cause significant discomfort and impact quality of life. In this video, we'll explore what Levator-Ani syndrome is, its potential causes, symptoms, and management options. Our goal is to provide you with a comprehensive overview, empowering you to better understand and address this condition. The exact cause of Levator-Ani syndrome remains unclear, making it a bit of a medical mystery. However, several factors are believed to contribute. These include chronic tension or spasms in the Levator-Ani muscles, which are a group of muscles supporting the pelvic floor. Potential triggers can range from direct trauma, such as childbirth, to psychological stress and even poor posture. In many cases, the origin is multifactorial, meaning it's a combination of several contributing elements rather than a single, easily identifiable cause. We're continuing to research and unravel the complexities of this condition's etiology. Levator-Ani syndrome is characterized by a complex interplay of muscle dysfunction and nerve sensitivity. The pelvic floor muscles, especially the Levator-Ani group, become hypertonic, meaning they are in a state of sustained contraction or spasm. This chronic muscle tension can lead to local inflammation and the development of trigger points, which are hypersensitive areas within the muscle that refer pain to other locations. In addition, the prolonged muscle tension can irritate the pudendal nerve, which provides sensation to the perineum, resulting in nerve-related pain. The resulting cycle of muscle spasm, inflammation, and nerve irritation perpetuates the condition. Estimating the true prevalence of Levator-Ani syndrome is challenging, as many individuals may experience symptoms but not seek medical attention due to embarrassment or lack of awareness. Studies suggest it affects women more frequently than men, particularly in the middle-aged to older adult population. However, it can occur in individuals of any age and gender. The variability in diagnostic criteria and the absence of a definitive diagnostic test also contribute to the difficulty in accurately determining its prevalence within the general population. The primary symptom of Levator-Ani syndrome is chronic rectal pain or itching, which can range from mild discomfort to severe, debilitating pain. This pain is typically located deep within the rectum or pelvis and is often described as a dull H pressure or a cramping sensation. Sitting for extended periods can exacerbate the pain. Other symptoms may include pain during or after bowel movements, a feeling of incomplete evacuation, and pain radiating to the lower back buttocks or thighs. Some individuals also report sexual dysfunction or urinary symptoms. It's important to note that the specific symptoms and their intensity can vary significantly from person to person. Diagnosing Levator-Ani syndrome often involves a thorough medical history, a physical examination, and a process of excluding other potential causes of pelvic pain. During the physical examination, a physician will typically perform a digital rectal exam to assess the tenderness and tone of the Levator-Ani muscles. The diagnosis is often made based on the Rome-IV criteria for functional and erectile pain, which includes chronic or recurrent rectal pain lasting for at least 3 months, with no evidence of organic pathology that would explain the symptoms. Additional tests, such as colonoscopy or pelvic MRI, may be performed to rule out other conditions like inflammatory bowel disease, hemorrhoids, or structural abnormalities. Nerve conduction studies or electromyography may also be used to evaluate pudendal nerve function. While there aren't distinct types of Levator-Ani syndrome per se, the condition can be categorized based on the severity of symptoms and the degree of muscle involvement. Some individuals may experience mild, intermittent symptoms that have minimal impact on their daily lives, while others may have severe, chronic pain that significantly impairs their ability to work, socialize, or engage in normal activities. The pattern of symptom exacerbation and remission can also vary. Understanding the specific characteristics of an individual's condition is important for tailoring an effective treatment plan. Treatment for Levator-Ani syndrome typically involves a multidisciplinary approach aimed at relieving pain, reducing muscle tension, and improving quality of life. Conservative measures, such as pelvic floor physical therapy, biofeedback, and relaxation techniques, are often the first line of treatment. Pelvic floor physical therapy can help to release muscle tension, improve muscle coordination, and reduce pain. Biofeedback can teach individuals to become more aware of their pelvic floor muscles and to consciously relax them. Pain medications, such as nonsteroidal anti-inflammatory drugs and NSAIDs or muscle relaxants, may be prescribed to alleviate pain. In some cases, trigger point injections with local anesthetics or corticosteroids may be used to reduce muscle pain and spasms. More invasive treatments, such as pudendal nerve blocks or surgery, are generally reserved for individuals who have not responded to conservative measures. Psychological therapies, such as cognitive behavioral therapy, a CBT, may also be helpful in managing pain and improving coping skills. While preventing Levator-Ani syndrome entirely may not be possible, there are steps that individuals can take to reduce their risk or minimize the severity of symptoms. Maintaining good posture, practicing regular exercise, and avoiding prolonged sitting can help to reduce muscle tension in the pelvic floor. Managing stress and anxiety can also be beneficial, as psychological factors can contribute to muscle tension and pain. For women, proper perineal care after childbirth may help to prevent the development of pelvic floor dysfunction. Individuals who experience early symptoms of pelvic pain should seek medical attention promptly to receive an accurate diagnosis and appropriate treatment. The prognosis for Levator-Ani syndrome varies depending on the individual and the severity of their symptoms. Many individuals experience significant improvement in their symptoms with appropriate treatment and management. However, some individuals may experience chronic pain and require ongoing management to control their symptoms. Recent research has focused on developing more effective treatments for Levator-Ani syndrome, including novel medications, advanced physical therapy techniques, and minimally invasive procedures. Studies are also investigating the role of inflammation and nerve sensitization in the pathogenesis of the condition, which may lead to new therapeutic targets in the future. Continued research efforts are essential to improving our understanding and management of this challenging condition.